Hi, this is Dr. Francis Winski, and today we're going to take some time to talk about Cellulaze. Cellulaze is the only FDA-approved treatment for the permanent reduction of cellulite. And what is cellulite? Ask any woman, she'll tell you what cellulite is. It's that dimpling, it's those dents, it's that mushy, cottage, cheesy look on my legs, on my buttock areas that they all want to get rid of. Well, cellulite is caused by several components. It's caused by the fullness of the fatty tissue between the fibrous septi, little bands of fibrous tissue that holds the skin in place. And it's caused by the thinning of the overlying deeper layer of the skin. That gives rise, in most cases, to what people have as the appearance of the cellulite. Cellulase is a three-step process that's designed to eliminate that. What it uses is a laser beam to first melt some of the deeper layers of fat in those areas where there are significant bulges. It then uses that laser beam in a side cutting mode to cut through those fibrous bands of tissue that we talked about that cause the indents. And as you're doing the procedure, you can actually see the indents get less as you cut through the band of tissue. It basically pops right up. And the third component of the procedure is designed to treat the undersurface of the skin to stimulate the collagen, which now thickens that layer of the skin. So those three components improve the appearance of cellulite. Now I tell all my patients that it's not perfect. You're not going to come out smooth as a tabletop. But if you get a 70–75% improvement in the area, would you do it? Knowing that I'm going to get them at least that much, if not more. And the majority of people say, sure, it's a no-brainer at that point. The problem comes up is that how fast you see the results. And here is where it gets a little sticky, because you're going to see some improvement almost immediately. The problem is you're swollen. When all the swelling goes away and the healing takes place, you will see that the skin looks thicker, it feels different, the texture of skin is different, and you're not going to have the lumps and bumps and indents you had before. Sure, you're going to have some, because the deepest indents are going to be nearly impossible to get rid of with this procedure. But the vast majority of people have a very good result, and so far over the course of time, the studies have shown that those results hold up. Right now we're looking at 5 and 6, 7-year follow-up studies, and they're lasting at least that long. So we're knowing that the effects that we have can be dramatic. What happens if you don't get everything out of it that you want? Can it be done again? Yes. And occasionally, some patients will come back and you'll occasionally treat another area or a section of the area that was previously treated to improve it even further. And so certainly that's a possibility. But by and large, the majority of patients have a good result and are very satisfied with their appearances after the procedure. So hopefully that can give you an idea of what you can do to get rid of that ugly cellulite.